My name is Rob Folks. I am from Reading, Pennsylvania. Right now I have type 2 diabetes, epilepsy, chronic asthma, chronic environmental allergies. I have high blood pressure. I have a skin condition called Ichthyosis. It causes my skin to plate up instead of fall off the way normal people's soft skin. And I'm also HIV positive. I manage all of these diseases with the help of medical assistants, and I'm on SNAP. I have not had health insurance throughout my life until I was diagnosed with HIV. Trying to get through those years prior to having insurance was a grind. I needed health care to hold a job. I needed to hold a job to get the insurance to get the health care. I was cycling through jobs every 20 days to 80 days. I couldn't really keep a hold of anything. I tried my best to grind it out, but I failed no matter what I did. The weirdest thing that you will ever hear anybody say, I'm about to say into this camera right now, HIV saved my life. Without that diagnosis, I would have been unable and uneligible to get the help that I need to survive right now. Why does somebody with that list of diseases have to go to the very bottom of their lives to get any help at all? Any one of these diseases can kill me. Any one of them. Diabetes is the most diabolical thing I ever have to deal with because it involves changing your entire life. But without a disease that had a lobby, without a disease that had a high profile, I would be dead. It shouldn't be that way. Coping with those diseases on the public healthcare system is really difficult because a lot of those diseases are specialists. Those specialists, even within the same hospital system like I have, rarely talk to each other. So getting information back and forth to them is difficult. And also, they don't understand exactly what is involved in each other's care. It's like learning how to juggle 6 balls, but from 6 different people. So they all teach you how to juggle 1 ball back and forth through each other's hands, but they don't understand the interplay between all 6. In my case, asthma is usually treated with steroids. Steroids will drive up your blood sugar. The higher blood sugar goes, the lower your immune system goes. That works with HIV. It makes my skin dry. Also, the ichthyosis makes my skin dry and plate off. So I'm constantly itchy. I constantly have an open wound somewhere. My skin integrity is almost never 100%. I'm constantly fighting infection. Recently, I just spent a week in a hospital on IV antibiotics and was discharged to 2 more weeks of oral antibiotics. This happens to me sometimes 2 to 3 times a year. But it's not considered an opportunistic infection. I'm not eligible for Social Security disability. I've tried 3 times. Makes it really hard to work and keep a job because I can't keep a job long enough to get the insurance, to get the health care I need to keep a job. So if I try to work, I'll lose my health benefits. If I work, the health benefits I get may not cover everything I need to have it cover. Currently, I spend retail insurance covers about $100,000 worth of prescription drugs a year for me. My HIV meds alone are almost $2,000 to $3,000 a month. If I had to afford that all myself, I would have to go straight from unemployment to Google, which is not going to happen for me. Fixing that really is almost fixing the entire system. Employment is difficult right now for me because of the doctor's appointments I have to keep. I was actually told in a job interview that they thought their job was not a priority for them. I would be too busy in doctor's appointments to give them 100% of my time. Which is true. I do enjoy breathing air and walking on dirt, not being buried under it. So they're right, but I don't think it's a really good reason to keep me out of a job. Trying to get, go back to school, get educated. difficult to do just monetarily. Education is expensive, it rises faster than inflation. I have a hard time with attention sometimes, balancing all these prescription drugs. Several of them say may cause drowsiness or dizziness, and darned if they're not right. Sometimes I can sleep, 10, 12, 13 hours a day. I don't mean to. I barely made it here this morning. But I do what I have to do. If not for the love of a good woman and a good support group like here at Cinder Blocks, I would not make it. And I feel like it's important to let people know that there are people like me out there in the world. They've fallen through the cracks, between disability and employment and being eligible for things like food stamps and medical assistance. I was uninsured until I was 38. When I was 38, I was diagnosed with HIV. Then I was worth helping. Then I could get the medical assistance. Then I could treat my diabetes, my epilepsy, everything that came after. All of those things were being managed by me patchwork. I knew they were there, but a lot of times I just had to either ignore them or just live with the consequences. It's certainly made things harder now. I would love to have, had a low blood sugar for 20 years, but, testing supplies cost money. Insulin, oddly, is available over the counter, but needles aren't. So you'd have to find a doctor to give you a prescription for needles and tell them, look, I may not be able to come back for 6 months to a year. Please look me up. And if I could find one that would do that, I could do that. But even then, maybe 2 to 3 doses a day. No long-acting insulin. So just trying to figure out how all that works kind of wrecked my life. I spent 20 years that way. And if you can't get any traction, can't get anything moving, you find yourself where I'm at. You're 45, you're sick, you want to do more with your life. But who wants a 45-year-old straight white dude with no education? My time, I feel like, is past, and this story is all I have now. So I will tell it to anyone that can benefit from it. This system needs to change. There need to be places for it. It's hard to find a good support system. I don't have family that I can rely on. I was an unwanted child. I survived an abortion attempt. I was born January 20th, 1973. Roe v. Wade was passed January 23rd, 1973. My mother told me 3 damn days for most of my life. I had to look it up to find out what she meant. She tried to abort me. I have a scar on my forehead that lit up like a Christmas tree during my first MRI during my first seizure. It's because there were metal fragments in my head. She tried to hang me. I can't trust my family. There's really nobody there. I have drifted in and out of relationships, in and out of places to be, places to go. I finally found the love of a good woman. She's from England, her name's Victoria, she just graduated nursing school, and she saw the good in me nobody else could. And she plucked me out of a gutter 10 years ago, took care of me, made sure I took care of myself, made sure that I was okay, helped me through my diagnosis period, helped me get back to the doctor, helped me realize that it was worth it. 4 years ago, my friend Regina Holiday reached out to me and let me know that she had an advocacy group going for patients by patients, and that she thought my story was worth telling. So I came, I took part in a panel, and something inside me just let loose, and I just spilled my guts in front of a room full of people. Most of my family, friends don't know anything about what I'm going through. And it was received well, and Regina kept asking me to come back and tell my story. I've tried to find different avenues, different tacks, different ways that it affects me, because I feel like I'm presenting in front of all of these talented, wonderful people that are changing the world, and I can't even change my own life. I'm an advocate for this patient. I wish I could be an advocate for more people in my position, but I feel like I don't have much credibility or standing to help those people. That's what the world tells me. Without Cinder Blocks, without these people behind me letting me know that I'm important enough to be listened to and to be heard, typically interacted with, I probably wouldn't have made it the last 4 or 5 years. I mean, we're at an age right now when healthcare is a big issue, drug prices are a big issue. It's a political issue now. Half of the politicians just see me as an easy vote. I vote for them, or the other half will demonize me, call me lazy, and take away my benefits. None of them address my issues. None of them will help me or others like me, or people like you watching, with affordable health care, affordable drug prices, matching the world in efficacy of treatment. You know, we spend the most, over $3 trillion a year in healthcare. We're not even top 10 in results. We're definitely not one of the happiest places to live. It's almost like justice in this country. You can have as much as you can afford. And the only way that can change is for people like me and the people here at Cinderblocks, people like Regina, and people like you watching to stand up and to tell your story and tell what needs to be done in your life and how that can be done for you. The more that we know about what's going on, the more people may be motivated to try to change it.